Hi, I'm John Luigi Bisleri. I'm a cardiac surgeon at St. Michael's Hospital, and I'm the director of minimally invasive cardiac surgery.
Hi, Neil Pham, interventional cardiologist. We're both plumbers, but when I do plumbing, I do a smaller incision. He does plumbing through a bigger incision, but he can fix more than I can. I'm the director of structural intervention program here at St. Michael's Hospital. So today we're going to be talking about what we do that makes us different at St. Michael's Hospital here in downtown Toronto. The parking is very expensive, but the care is excellent. That's what differentiates us from other hospitals. So, John, why don't you just get started? Tell us what's the latest things you're doing here and how we can help patients.
Yeah, so as you just mentioned, I think what's really important at St. Michael's is that we have in cardiac surgery had a history of excellent care with the entire spectrum, so the entire type of procedures in cardiac surgery that could be performed, being delivered and performed at St. Michael's. Over the past few years, we developed a focus on new kind of procedures in cardiac surgery, especially what we call minimally invasive cardiac surgery, which is a procedure that actually really probably fills the gap between conventional cardiac surgery and the catheter-based procedures we are performing. So we are able to still reproduce the quality and the extent of work we normally would do with bigger incisions, but through way smaller approaches. So we no longer open the chest of people, and in some cases, we can even avoid opening the heart or stopping the heart. I think it's important for the audience to understand the real important spectrum of procedures where we completely avoid heart-lung machines like catheter-based procedures.
Mm-hmm. So catheter-based procedures that we do have become quite sophisticated, such as TAVI, which is aortic valve replacement, but done through a catheter in the groin, mitral clip, which is to repair the mitral valve, the tricuspid valve. These patients can often go home either the same day as the procedure or the next day, which really minimizes the recovery. You know, the procedures that we're doing are largely for more elderly patients who are too high risk to have open heart surgery. But the beauty of our program, which is not the same as all programs, is we actually work well together as a team, what's called a heart team, where we try to make the best decision for an individual patient. It doesn't matter whether they're coming from Toronto or outside of our province. St. Michael's is always willing to provide care to patients regardless of where they're coming from. So we're in the midst of a revolution in heart care because now we can offer the least invasive procedure to the most invasive procedure, whatever is actually required to get the patient the best outcome.
Yeah, I think you're raising a very important point is the fact that not only technically cover the entire spectrum from the least invasive to intermediate level of invasiveness to the most invasive procedures, and as you said, different hospital stay, different obviously recovery for patients, but also this is not done in a conflicting way, but very much in a cohesive way. So I would say almost the entirety of our discussions are collegiate, and we always tailor the treatment and use one of these different approaches.
I think that's a key point, John, is if you get a referral to St. Michael's Hospital, structural heart program, cardiac surgery program, we're going to still review the case to collectively as a team and then make the best decision for that patient. What makes us different? We have a lot of access to very innovative first-in-human procedures with new valves, new devices to repair, replace heart valves, and get the patient to recover as quickly as possible. We're very experienced with doing these new procedures. We have an excellent team, fantastic imaging team that includes radiology. We have echocardiologists who guide the procedures for us so we can do it truly minimally invasive. And then we have very strong nurse coordinators, nurses who can get the patient through the hospital and home on their way to recovery.
And I would also add that from the surgical standpoint, similarly, in order to perform these innovative procedures, we need the entire team, which for us, obviously, in the OR is not just the obviously OR team, nursing. We have teams called perfusionists taking care of the heart machine, but very importantly, the anesthesia ICU, because we are trying really to impact the recovery of patients with something called enhanced recovery. So we just not simply perform smaller incisions, but we overall impact the speed of recovery and the journey of patients. Maybe like a few words about specifically what are some key innovations in the catheter world that we have been pioneering at St. Michael's from the catheter, and we can talk about the surgical.
So 5 years ago, St. Michael's did the first catheter-based tricuspid valve replacement with the Evoke valve. This is now approved for use in the U.S. and Europe, and will soon be coming to Canada. So it's certainly a matter of pride for us. But we've also done, first in Canada procedures with transcatheter mitral valve replacements, aortic valve replacements. So really, we have a passion for innovation, but we also are rooted in very excellent clinical care for the patient, and that's what it's about. So, Gian, this all sounds great. How do patients get to see us? How do they get referred?
Yeah, so I think that the question is obviously for people first to be aware about these innovations, because as you just mentioned, also let me just add from the surgical standpoint, in a few years since we established this minimal invasive program, we have now grown to be the largest minimal invasive mitral program in the entire GTA, and I would say probably one of the largest in the country as well. And for atrial fibrillation management, together with our EP colleagues, we are the only center in Canada to offer something called hybrid ablation. So to your point is that how can people be referred? I think it's really a matter also of patients being aware about this. And there are so many avenues. Patient can come through the structural heart clinic or directly contacting even us as surgeons. And we can then have this collegiate way of addressing and identifying the best strategies. So really, we are trying, I think, very actively, especially in the GTA, to inform family physicians, cardiologists in community about these innovations. But it's also important for people to use this kind of media so that they can become aware and ask for a second opinion. I don't know
This
if
is
you.
a key point. So at St. Michael's Hospital, Urban Angel, we basically don't say no to anybody, and we're always willing to provide a second or sometimes third opinion so that we can get the best outcome for patients. So, John, I have a funny question for you. What is your favorite kind of music?
My favorite music is rock music. I do actually play that also. I got plenty of guitars, which unfortunately I don't think I got to work more on that angle. And what about you?
I started with hard rock and I go all the way to hip hop, so I'm open to anything.
All right.